All right, welcome back, everybody. I am Dr. Greg Eckel, and this is What the Health. Today, I have a special treat. We have Dr. Ameet coming at us from Kenya. He is voted a top 43 therapist worldwide. He has health.drameet.com, and he's got best-selling books that have helped thousands of people heal from anxiety, depression, hormone issues, obesity, fatigue, and other chronic health conditions. He combines naturopathic medicine, functional medicine, psychotherapy, family constellations, EMDR, and trauma therapy to help you heal your mind and body for optimal well-being. Dr. Ameet, welcome aboard What the Health.
Greetings, everyone. Greetings from Kenya. Greg, thanks for that lovely introduction. It was a bit overwhelming for me to listen to all that.
You know, it is a lot to unpack there, right? And what we're going to do, we're going to kind of just start with your work and how you package all of this together. You know, each individual practitioner has their own style. I think you're doing some just fascinating stuff online, trying to, you know, help as many people as you can, and then also in your local community as well. So I'm excited to talk about all of those. Let's start with your online work on how you're reaching out from Kenya. How did you get to that point? Like, what made you want to go online to take your message to the world?
Okay. Well, I guess it just happened serendipitously. I want to raise enough funds for mobile clinics and for poor communities in Kenya. So at the moment, I'm treating some disabled children who have been abandoned because of the stigma with homeopathy. And I used to do mobile clinics in the bush, taking homeopathy to poor people. And so my aim was to raise enough funds through book sales and online courses so that I can self-fund this project rather than depending on donors and stuff like that. Yeah, I mean, donors are always welcome, but it's nice to self-fund your projects once in a while. Yeah, and online, it just exploded. Like, my book became a bestseller, and then I got requests for a lot of appointments. People want to work on their emotions as well as their physical body, because we all have trapped emotions, right? Trauma when we were children, belief systems, because I don't know, maybe dad went on a journey somewhere and left you with mom, or there was fighting in the family, or your boss told you off. Whatever happened, it creates a certain fight or flight response in the body. And people are experiencing adrenal fatigue, headaches, migraines, etc., and only taking supplements, right? And it's not treating the root cause. And so what I'm finding is when you do the emotional work, the release, then people need less supplements, right? Because you change the physiology after you heal the emotions. And when you heal the emotions and the physiology changes to be healthier, you don't need so much adrenal support, for example, because you're not burning out your system with subconscious fight or flight responses. Does that make sense?
That totally does. That totally does. So, all right. So I'm going to unpack this a slightly different then. Let's start with the work that you're doing, that you're supporting with the online component. So tell me about what are you said you're taking this medicine out into the bush, and you've got a clinic in the city there. Maybe let's talk to that first.
Okay, so I wear multiple hats.
Yes.
So as a psychotherapist and a naturopath, I'm doing worldwide consults online, yeah? And then in Kenya, I have a clinic in Nairobi for private practice. The reason I came back home to Kenya from Canada was to start mobile clinics for poor communities. And there I would drive in a Jeep, and I would supervise doctors and students from around the world, and we'd go in the bush, sleep with lions, elephants, etc., and treat poor communities who had no healthcare. And it's a dream project. It's a fantastic project. And I ran out of funding. And so I had to put a pause on it also because my mom was going through cancer treatment. But now with the online course sales and book sales, I can get enough, and then I can go and help some communities. So now what I'm doing is, with the book sales, I'm managing to help. There's a disabled children's home. The children have been abandoned because, you know, they're born with cerebral palsy or autism or basically crooked joints. They're just left alone there. And people rescue them and they come to a home. And then I saw this, I was like, oh my God, you know, homeopathy can be amazing for this. And just some simple vitamins and using probiotics and nutritional supplements to improve absorption. Because we got like 8 to 10-year-old kids who look like 3-year-olds or 4-year-olds. It's unbelievable. Like, it's shocking to the eyes when like a little 2-year-old, what you think is a 2 or 3-year-old kid, actually talks to you fully, like, oh my God, how do you know how to talk, kind of thing,
Yeah.
right? And you find out they're actually 8 years old and their joints are all distorted and stuff like that. So hopefully I'll use some Ruta, Rustox, and some other homeopathics and see what's happening.
Is that in a specific center or
Mhm.
organization, or how are you delivering that care?
Yeah. So because I used to do mobile clinics for lots of communities, I got in contact with a lot of little organizations here and there. And so this one nurse that I know, she called me and says, look, Amit, we've started this home and we're rescuing children. Please come and see it. And so I go and visit the home and I was like, holy cow, it was shocking. Yeah. And so now I'm just taking them some, like, me as a naturopath, this is my angle of what to do, right? Is to help them become healthier and better and more cognitive. So I'm just taking them supplements and nutritional, just easy to digest foods, because some of them cannot even chew.
Wow.
Yeah, so it's good though. Like, I really believe, like, already one child who was not even responding to signals and was drooling a lot. In a week's time, the drooling has stopped with homeopathy.
Hmm.
And then there's another kid who has been screaming and grinding his teeth a lot. And we're using homeopathy. The grinding after 4 days has reduced. So I have to go and do a follow-up and see if I need to increase the dose or just repeat the remedy.
Wow. So you go every week or every day? Like, what's your schedule look like
Mm.
over there?
So I just started with this home. So I'm planning to do once a week at least.
Got it.
So I give
Excellent.
them remedies. I give them remedies enough for a week, and then come back and then just monitor and then change the dosage.
Lovely. Wow, that is awesome work. And so that component, do you have like a nonprofit that people can donate to, or where are you at with that?
I had a Canadian charity that I started, but because my mom was going through stuff, I had to close it down and just put it on hold. And so what I do is I just collect donations through my site and encourage people to buy the course and my online course and the books. So buy 10 books at a time or something like that. So it's a give and a win-win, right? So you're not
Yeah,
just, you're getting something back for your donation.
sure.
And for me, that feels more in balance. I actually feel better about it rather than being responsible for somebody's donation where you might not be able to go for months because of the weather or something like that, right? And I don't like hanging on. Like, I just prefer people get something back
Sure.
for what they give. It feels more equal.
A really nice exchange for sure.
Yeah, yeah.
What, so to really, it was out of innovation to help serve your country, right? And the health there. You moved home from Canada, so you graduated from Canadian College in Naturopathic Medicine.
Yeah.
Um, and how are you still accepting students and doctors coming out to help treat and do the mission work?
Right now, I've put a pause on the visits, the student trips, and until I iron out a few details, because it's a lot of responsibility supervising people. But the thing is, I teach every year in Italy a course on mental health, right? So it's an experiential course where people go through Gestalt therapy, family constellation, just emotional healing, and learning about naturopathic medicine to treat mental health.
Mm.
And so I'd like to recreate this program in Kenya for the North American students and doctors to come back to Kenya, and they go through this personal growth program with me here, and then we can do some community work. So I just want
Oh,
to refine those details.
yeah, lovely. What, so let's talk about that work. So healing trauma, you're seeing trauma, you're treating children and folks out in the bush. So you're seeing a lot of trauma, and you're saying, you're not having to use as much supplementation or medications when dealing with the emotional component of it. So what's your process of working with folks around that?
Okay, so it's not only in the bush, like internationally, most people are suffering from trauma.
Oh
Everyone
yeah.
has some sort of trauma. Either it's, abandonment by a partner, or father doing strange things, or sexual abuse, or financial stress, or, trauma. And so these events create overwhelm in the body, and the person or the soul or the individual adjust themselves to cope with the overwhelm. So you might, for example, you might go into depression, or you might cry a lot, or you might work harder, or you might be more loyal to your mother, or you might block yourself from really loving somebody else, a new person. All these strange things happen as adjustments to overwhelm. And we bring awareness to these adjustments of how you're doing it, how you're in the process of an adjustment. Even though the event happened 20 years ago, you're still subconsciously compensating. And that compensation actually burns out your adrenal glands. One, it changes your physiology. So your liver might get more stagnant, for example, or you might have cortisol imbalance. And all these things cause chronic disease. And so when you release the stress and the trauma, the adrenal glands stabilize, you have more stable cortisol levels, your inflammatory response reduces, yeah, your burnout reduces, your tendency towards burnout reduces. So therefore, I can wean you off the supplements as well. Of course, you stay on a maintenance dose to keep healthy because of all the stress anyways in life, but you're not using bandage solution supplements anymore. You're just healing the core.
Got it. And do you have, so you employ, I mean, you do EMDR. Do you find that the family constellation work, you put it all to, like, is it a full court press, or you kind of pick out the specifics for each case?
It depends on what's happening in the moment with the person. So if I sense, okay, there's something to do with a parent, right there and there, I'll pause the session. I'll say, okay, let's go into some deeper work. Let's go into some work right now. So if they're telling me the story about, their life, and they mention an abortion as if it's just like, or a miscarriage, just by the way, I'll pause the session and say, great, now let's connect with that child. Because a lot of people are brought up thinking an aborted or miscarried child doesn't need to be recognized or acknowledged. And I'm telling you, Greg, it's such a painful experience if you really acknowledge it. And a lot of people's anxiety and relationship issues disappear when we heal or conclude a miscarriage or abortion in the right way, in a family constellations way, for example. And
Sure.
then as they're processing the emotions, then I'll slip in some EMDR to help them deepen the processing. So that's eye movement, desensitization, and reprocessing. I'll get them to tap as well, so their nervous system adjusts and integrates or digests what they're processing emotionally. And then I'll recognize, gosh, there's a severe trauma there of, let's say, abandonment or shame, and I know the homeopathic remedy for that event. It might be Ignatia, for example. So I'll say, great, now I know that they need Ignatia to heal this layer of their life as well. So they're getting beautiful support, yeah, to guide them through, really to flush out this deep-seated not good enough feeling or self-sabotage behavior, whatever they started doing when they were abandoned or abused or whatever, yeah?
So that component, so let's talk about a couple of those therapies that you mentioned for folks that may not know. So family constellation work, what is that?
Family constellation work is a very powerful technique. It falls in the realm of almost psychotherapy. It's exploding in Europe and in North America actually now, where we look at what we call the orders of love. So in a family system, there's always an order, like a balance. And there's a healthy way of communicating and connecting with each other. And we all have tendencies to go out of balance. So for example, if your mom was abandoned by your dad, then you might create a closer bond with your mom, which would be different if your dad was around. Yeah, so suddenly when dad goes, you're not the innocent child anymore. You are like the bond to your mother. And you become like an adult to your mom very fast, rather than remaining the child to two parents. And that transition into adulthood too early, and that kind of, I would call it, for lack of a better word, the artificial bond with your mother, because the partner's not there, blocks you from being free and maybe getting to healthy relationships, things like that. And so that's one example of an imbalance. Another imbalance is If your mom had a miscarriage and then you were born after the miscarriage and you think you're firstborn, you're actually the second child in the system. And if you don't recognize that you're the second child, you'll have this chronic anxiety and sense of overwhelm in life, feeling like there's too much to do in life. I know it sounds very woo-woo out there, but it's so powerful. It's the fastest growing therapy out in Europe. Like Bert Hellinger created it. Governments are using it now, and organizations are using it as well to bring back balance into a system. And the therapy uses certain sentences that are spoken, and these sentences bring awareness to the adjustment that needs to take place. For example, the child with the abandoned mother could say, "Dear mom, I'm the son, not your partner. I'm the son, you're my mom. Let me be the child again. Yeah, let me feel what it's like to be innocent without the responsibility of being too close to you anymore."
Wow.
Yeah, you feel it, yeah?
Yeah, for sure.
Yeah,
And
it's
then
deep, right?
it is that I have found that family constellation work is super powerful on multiple levels, and even healing family trees of past traumas from the folks that have passed even. So that's amazing work to do around ancestral traumas as well. So then you layer the EMDR. So speak to that then.
Okay, so EMDR is a psychotherapeutic or trauma release technique that's now more and more officially recognized, and it's being used for PTSD for war veterans and basically all forms of PTSD. And where EMDR works wonderfully because it rewires your nervous system. It helps a discharge, like a release of emotional tension and subconscious fight or flights that's still stuck in your nervous system. And what I get people to do is just go to the place of trauma, to the feeling, the memory of it, the image of it, the sensation of it, the negative beliefs around that trauma. So I'm simplifying it, yeah, but I go very deep with people. The negative belief, so it might be I'm not good enough, or I'm not safe, or I'm going to die. At the moment of trauma, there's a negative belief that comes up right away as a self-protection mechanism. And that self-protection mechanism doesn't just disappear. It lives in our cells, right? Because the body remembers all this stuff. And we don't realize that the body's holding on to that negative belief. And we're basically adjusting and trying to carry on with life. And we're still stuck in that cycle. Anyways, as they connect to all these sensations, then I'll get them to follow my fingers from left to right. And my online course covers a lot of these trauma healing techniques, so people can really use them on their own, some of them. And so they follow the fingers left to right while staying with the sensations. And the movement of, it's called bilateral stimulation. When you move your eyes left to right, or you tap left and right on your collarbones, what happens is it stimulates both hemispheres of the brain. And also it stimulates, because you're connected to the emotion, you're remembering the trauma, and you're bilaterally stimulating your brain. What happens is the thinking brain, the frontal cortex, begins to process the deep subconscious trauma that was left stuck. You suddenly recognize, oh, I'm not there anymore. Like your mind catches up with reality. And you realize, oh, I'm away from that abusive teacher, or I'm away from that dangerous man or woman or whatever it was, yeah? And your body feels the safety all of a sudden. Rather than only you thinking cognitively, your body feels the safety. And when your body recognizes it, like viscerally, you get a somatic experience and a somatic change, then your nervous system just relaxes and discharges, and you can cry, you can relieve, you can sigh, all these things happen. And when that happens, you're not in fight or flight. And guess what? Your adrenal glands heal themselves then.
Wow, that's awesome. So those releases, you see that when you're working with your patients.
Oh, all the time. Yeah, absolutely. And you got to learn how to make them comfortable being in the release, holding the space for them to be comfortable with their vulnerability.
And then you follow that up with homeopathics.
Sometimes, yes. Sometimes I'll do homeopathy. Sometimes the trauma release is enough. So they've gone through enough of the trauma relief and they're fine. And then I'll say, okay, you know what? You're wiped out from all that nervousness that you're going on. let's give you some adrenal support to build you up again, but you don't need it for long. Yeah.
Yeah.
Or let's clean out the liver because, because of tension or because of poor diet, too much inflammation, your liver is all bunged up. So most people make a mistake of only treating the gut with probiotics, fish oils, vitamin D, etc. And the missing link for most people is the liver. And in my online course, I cover all the liver remedies. And I've also released a new book on all the liver remedies, because the liver is the master organ, right? It produces bile and digestive juices and detoxifies your body. So, and processes cholesterol. So when your liver is stagnant because of too much alcohol, too much medications, pesticides, and inflammation from leaky gut, the liver becomes stagnant. It produces less bile, so you get more gas, bloating, indigestion, constipation, and more leaky gut. And you also get a hormonal imbalance. So most gas, bloating, and constipation, and the worsening of leaky gut is usually due to liver stagnation rather than only a probiotic issue. And PMS symptoms, hormonal balances, infertility, always treat the liver.
You sound like a naturopathic physician. the so our listeners of What the Health are really excited to hear this message. It's what we're educating. So again, everybody, this is What the Health. I'm Dr. Greg Eckel. This is Dr. Ameet coming at you from Kenya, and spreading the good word on the internet. So I want to just bring some attention and light to your courses and help support your work in Kenya there. This trauma basis of therapies is it's overlooked in Western medicine. And it is such, when you look at, you said it, like there's trauma around the world, right? And, even in light of modern circumstances, there's even more trauma, right? So, it's kind of the statement of life, nobody gets out of here alive. And it is, but it's what we do with it, right? Like how we respond to circumstances and what's happening. And when you're not able to reach your creative beingness because of past traumas or unconscious kind of programs that are running, this work is just essential to get out there. We have such need for it, and the discussion, I think very timely right now in light of, we have current pandemic, and in the United States, more just blatant racism coming to the surface. These shadows of our societies we're basically just faced with them, right? People are shuttered in, faced with their demons, basically. And this work is really essential to help unlock and free our souls, basically. It's a big piece of what I see, the healing that has to happen in this realm.
Absolutely. Because emotional support is crucial at this time, right? A lot of people are suffering from isolation with Corona, this whole racial tension that's going on. The violence is also, I believe, a stand against the system that's oppressing humans. And it's not only a racist issue, I think, it's also a suppression of humans by governments. People have been losing their rights over time. And with this uprising, I think human beings are going to get their rights, and it'll be more democracy per se. And when we have more democracy and the ability to emote ourselves, there's less trauma as well, right? Hopefully. But the emotional support is super crucial at this time. So I really encourage people to go see their therapist, get some support, right? Even though you think you're fine, your body is holding on to a lot of emotional tension that needs to come out. And the thing is, depending on how you grew up, right? If you grew up as a traumatized child, the way you're processing stress in the modern time as an adult is deeply affected by your childhood traumas. And that's what I work with people is on their child self, their inner child work, their inner child, because one person deals with trauma differently from another person. And that totally depends on their upbringing. Right? And so,
yeah, so explain that.
Okay. What happens is, if I grow up traumatized and bullied and stuff like that as a child, I will be fragile. I'll feel vulnerable, or, I'll attack weak people, or I won't trust myself. Versus somebody who grew up healthy, love, support, and everything will have self-confidence and will not feel so threatened. And so when both people experience some event, the fragile person might overreact, might feel very afraid or stigmatized or self-conscious and lose their self-esteem very fast. And it's just a resurfacing of what happened for them as a child, versus the other person might not take it so personally and might bounce back faster. And so by healing these adjustments, what we call creative adjustments in Gestalt psychotherapy, by healing these adjustments that we did in childhood and bringing awareness to how we were feeling as children and letting those feelings go and reintegrating with healthier beliefs, then we bounce back faster. Yeah, we're less stigmatized or overwhelmed by trauma as adults when we heal the fragile child within us.
Cool. That is, so that component, I mean, I'm guessing when you are delivering care to folks that don't have access to healthcare, you're seeing maybe another level of trauma.
Yeah, the bushwork is a lot of just acute and chronic disease that's mostly physical. There is a bit of emotional work, and then we'll using mostly homeopathy, yeah? Because remember, some of these people are nomadic, so I don't get to see them. They go with their cows and goats out in the bush, and I don't get to see them again.
Yeah.
So I need to give them enough homeopathy to last. So, and because it's the whole village, it's not like you're sitting having the luxury of an hour consult or anything, right?
Yeah.
So I'll get as much information as I can, and then I'll give them 2 or 3 different homeopathic remedies for different layers of their lives. And so some might have trauma, so I'll give them remedies for the trauma, because homeopathy is amazing for healing trauma as well as psychotherapy. Homeopathy can actually heal the past traumas, by the way. I've seen that happen thousands and thousands of times. And then I'll also give them remedies for their present condition, right? It's a skin ailment, or it's a digestive issue, or it's a headache or liver stagnation, whatever it may be. I'll give them those remedies as well.
Got it. All right.
Like for example, the children living with disabilities, there's obviously abandonment trauma, right? And so there's remedies I'm going to use once I heal their physiology with the homeopathic remedies for for absorption and nutrition, and their joints are all like twisted because they've been left lying abandoned, so they didn't have time to straighten their legs, kind of thing. Once I heal those, then I'll go and work on using abandonment remedies in homeopathy as well.
Wow. So, and you've been at that work. How long have you been doing that work there?
Well, the children with disabilities I just started recently, about 3 weeks ago, but the mobile clinics I started 2008, I think.
Okay. Yeah. Very good. Very good. So lots of experience and really clinical results. What can you share any stories of folks, or kind of experiences that you've had with your system, and what kind of healing you've seen?
Just generally, or on the mobile clinics, or generally with the general population?
Just
everyone?
Generally, like something that first story that pops up.
Okay, first story that pops up. The chief medical officer for a high commission, I don't want to say which one.
Sure.
Came to see me with burnout, suicidal thoughts, etc. And she believes in her medicine. She's been on antidepressants. We worked on basically releasing trauma. I did a lot of Bowen therapy on her, rebuilt her adrenal system, and used homeopathy. Within 3 months, no suicidal thoughts, adrenal fatigue gone. She was completely healthy, yeah, and she moved on to get another job.
Wow.
HIV patient on the mobile clinics. His wound was not healing. He had this big gashing wound on his leg. It was ulcerating and all that stuff, yeah. And he was on ARVs. And then we came along. That wound hadn't healed for 3 years, Greg. 3 years. There was an open wound. Septic. Yeah. It was crazy. And we came along. I can't remember the remedies I gave him. I think I gave him hypericum and ledum homeopathically. Hypericum and maybe calendula. I can't remember. This was a long time ago.
Sure.
And boom, it started closing. I have pictures on it on my website on some picture from Africa. There was a woman
Lovely.
with a goiter on the mobile clinics. The goiter started shrinking. The remedy there, I remember, was phosphorus. Um, I've had people, let's say, who were married. She was married to an abusive husband, yeah, an alcoholic partner, or she had a pattern of going with alcoholic partners. And we found out her mom, her dad was an alcoholic, and her mom really suffered a lot and stayed with the dad. So, in a family constellation sense, she was very loyal to her mother's suffering. She could not be happier than her mother, because that would be subconsciously at a soul level, that would mean abandoning her mother.
Wow.
So by suffering as much as her mother, she's still being a partner to her mother. And so by bringing that awareness, boom, she was able to divorce this guy and live a
Wow.
good life.
Wow.
So
Yeah.
those
So
are the,
unconscious patterning that gets us stuck. Um, wow.
yeah.
All right. So we are coming down to the last 10 minutes of the show. I wanted to ask you about kind of just current affairs in Kenya, right? We don't really get to talk so often. Maybe we're talking quarterly, planning a trip out to Kenya. What's it looking like? You said you had to close your office in the city. What's life looking like now for you in Kenya with COVID?
Okay. Well, yeah, so coronavirus doesn't seem to be exploding here yet. Either through all the measures we're taking of social distancing, wearing masks, that we took a lot of measures very fast. At the same time, a lot of people are finding that, strangely, I don't know if this is true or not, but there seems to be talk about our immune system being quite healthy here, because the death rate is not as high as other countries, right?
Yeah.
And because by now it would have exploded, but we don't have it yet,
Right.
interestingly. So people are quite relaxed about it, to be honest. I mean, they've shut down the city, so no one can leave Nairobi, and thank God I'm out, because otherwise it's a toxic place. But they've shut down the city, so no one can enter or leave the city and certain big towns. Flights are all closed, but in a week's time, they're thinking of reopening the whole country.
Huh.
Yeah.
Wow.
So
Yeah.
we'll see how it goes. We'll see if there's an explosion or not of cases.
Yeah. Interesting. So testing, and along that lines, you all are testing well, or we don't know. You're just
So
not
they're
seeing
doing
any changes of health.
the cases are increasing. Like, there are daily increases in cases, but we're not seeing high death rates here.
Uh-huh.
And of course, the availability of all the test kits is not so available here in Africa. Yeah.
Sure.
So I think testing is minimal, but that doesn't say that that's the reason why there's not many cases. You know what I mean? Because people say, well, you don't have many cases because no one's testing, but we haven't seen such high death rates yet.
Right. And you very well may not, with that component around, not having too many pre-existing conditions, although I'm guessing diabetes and heart disease definitely run rampant in Kenya.
Yeah, it's on the rise. Like, Kenya is a very modern country, so we have modern diseases nowadays. Like, the city is a very high stress place. People are eating junk food. They don't take care of their health. So definitely we have a lot of diabetes and heart disease in Africa.
Yeah.
But still, the explosion of deaths and stuff like that hasn't happened here, touch wood, yet.
Wow. Yeah. All right. And so your work carries on with getting the word out. You're open for consults online. And I'm definitely going to put a link in for your course here in the show notes, and help get some energy and attention there, just to help support you in that really amazing work that you're doing in Kenya.
Thank you.
In closing, do you have anything that you'd like to share with the listeners and viewers of What the Health?
What intuitively comes up is love yourself. So love yourself for all the traumas you've been through. And I don't know why I'm saying this, but whether you believe in God or not, like, God can be medicine as well, so for some people, And so I'm reading a course in miracles, and it's a very deep book about connecting with spirit and stuff like that. Forgive yourself for being traumatized. Forgive yourself for judging people and making adjustments in childhood to run away from a perpetrator or somebody who abused you. Yeah, bring some self-love back into your nervous system, into your body, and then be patient with yourself, because all these things then heal your nervous system, bring back balance, and really self-love is medicine.
Mm.
And it's different from arrogance, yeah, and it's different from denial. It's really being vulnerable and compassionate with yourself and saying, it's okay to cry, it's okay to break down, and it's okay to pick myself up again.
Lovely. Thank you for sharing that.
Thank you.
All right, everyone. This is What the Health, bringing you the important information you need for your self-love, your family, and your community. This is actually how we change the world. Getting this message out, share it with your friends and family, leave us a review on your favorite podcast platform. We are here Tuesdays from 2 to 3 p.m. Pacific Standard Time every week. Thanks for tuning in.
Thank you, everyone. Big hug. Lots of love.